We learned this week, Mr Deputy Speaker, that instead of ensuring funding reaches the front line, spending on staff at the Department of Health and Social Care and 7 other arm's-length bodies has increased by more than 10% since Labour came to power, while GPs, social care providers and hospices are forced to do more with less. The situation is further compounded by rising financial pressures, and despite repeated promises that additional funding would improve patient care, the NHS England Chief Financial Officer confirmed to this Select Committee that all the extra money allocated to the NHS will be swallowed up by national insurance increases, inflation and pay settlements, meaning none of it will go towards real improvements in frontline care. The rise in national insurance contributions was supposed to bolster the NHS and social care. In reality, it has landed like an extra tax on providers themselves. GP surgeries, care homes, hospices and community services are all grappling with these additional payroll costs, just as they struggle with surging demand and chronic workforce shortages. The Institute of General Practice Management estimates that the average GP practice now pays an extra £20,000 a year in national insurance alone. Across the nearly 6,500 practices, this adds up to around £125 million a year, money that could otherwise pay for more than 2 million GP appointments at a time when patients are struggling to be seen. Adult social care providers face an equally stark reality. The Nuffield Trust projects that employers will shoulder nearly £940 million in extra national insurance costs in this financial year, and that's on top of the £1.85 billion required to cover the rise of the national living wage. Local councils already face a £665 million shortfall just to deliver their legal social care duties. The government has promised a 3% real terms rise in the NHS revenue spending each year to 28-29, reaching £232 billion by the end of the year. Yet despite these headline increases, capital investment is being held flat in real terms. NHS leaders have made clear that this will not be enough to rebuild or modernise our hospitals, nor to fund the facilities required to support more care in the community. The Health and Social Care Committee's recent inquiry, Adult Social Care, the Cost of Inaction, has drawn attention to the enormous human and economic toll of the government's failure to reform the care sector. From the burden of unpaid carers to the economic impact of people leaving the workforce due to unmet care needs, the system is under severe and unsustainable strain. But rather than tackling this issue, once again this government has kicked social care into the long grass, waiting for a report from Baroness Casey that probably will not report until the very end of the session. Not least the fact that the cross-party talks which this government promised have been again scrapped. So although the spending review includes £4 billion in additional adult social care funding and an increase in the NHS minimum contribution to the Better Care Fund, there remains little clarity on how the government will fund its commitment to deliver a fair pay agreement for care workers. It is also far from clear, Mr Deputy Speaker, that the Better Care Fund is currently structured to meet the real needs of the care sector, rather than simply alleviating pressures in primary care. These are not abstract figures, they translate directly into longer waits for elderly patients, overstretched family carers and staff driven to exhaustion. So, questions to the Minister. In light of this, can the Minister confirm exactly how much funding the government will allocate next year to tackle the social care workforce emergency, reducing waiting lists for assessments and services, and ensure councils can meet their statutory obligations? Secondly, what concrete recruitment and retention measures will be put in place to attract and retain carers, nurses and support workers in this vital sector? And how much new capital investment will be committed to help providers modernise facilities and expand capacity to meet the needs of our growing and ageing population? When will the cross-party talks that the government promised on social care happen? They must happen, otherwise all the good effort on all sides of the House on this issue will be lost. Finally, Mr Deputy Speaker, with social care vacancies entrenched and NHS productivity still trailing pre-pandemic levels, will the Minister set out what credible workforce and capital investment plans will be included in the forthcoming NHS 10-year plan to address these challenges once and for all? Mr Deputy Speaker, I want to pay tribute to all the health and social care workers, whether employed or voluntary, across this country. This government has a real opportunity, with its massive majority, to make real changes. It must start doing so now and do so quickly.